We didn't know when we were there or when we first came back that was what God had in mind for us being in Madagascar in the first place, was to see the need, but also to see the beauty of his work there. And so when we came back, it just started with one thing here or there where Stan Quanback would request, and then it grew into barrels and crates and containers and warehouses, and the story goes on. When we arrived in Madagascar back in the 70s, one of the first meetings that we went to was among the mission staff, and it was about whether or not the Lutheran Church would be continuing to do medical work in Madagascar.
But one summer, John Toso came and visited us, and he said, "It's terrible out there. The mission hospitals are deteriorating badly. The surgical equipment that you used when you were out there, we're still being forced to use."
People were coming back from trips to Africa and saying these medical mission hospitals really are having a hard time. Their expenses are increasing, they don't have the staff, they don't have the equipment. And as we were planning for the new church, I saw that the budget for health care was not going to go up.
The problem that confronted us was the loss of continued financing for our medical institutions. The subsidies that hospitals in Madagascar were drying up, and still we had to run the hospitals.
You could go along needing just some small part or some supply, but without someone back on the state side to help with that, it just wasn't there.
If we were going to continue in health care and medical mission work, something else had to be done. Something had to be found to support these healthcare programs and the staff that were in them.
By 1985, several of us attended a continuing medical education conference at Brackenhurst in Kenya. And there we met a Presbyterian missionary who said that, well, we in the Presbyterian Church have formed our own foundation, our own ministry to support our medical work when the churches as a whole dropped off.
They had a budget of $1 million a year for their medical missions program, which was pie in the sky for us. We couldn't imagine that.
And we said to ourselves, well, if the Presbyterian Church can do it, why can't we as the Lutherans do it? And that was actually the conception of Global Health Ministries.
That's what really started us thinking something has to be done. We felt this somehow we could do something from this part of the world to help. And then other doctors got interested too, they were also worried about it.
In the early formational meetings of what would become GHM, one of the things that we focused on was the fact that the smaller and mid-sized projects, those needs weren't being met. And so that was one of the first goals and challenges of this new organization, was to be able to be responsive to the needs when they happened.
We were handicapped in the churches. I can use that phrase now, I guess. We were handicapped because we as staff members could not go out and solicit money for particular projects. We could solicit money and raise the concerns of the total church, but we couldn't say that this hospital needs an x-ray machine, we need a scholarship for this person. We couldn't do that. But in a new organization where we could raise our own funds, we would have the ability and the right to go out and say, this is a specific need that exists, and if you can help us with this, we can do it, and we can do it immediately. We don't have to go through a long process.
We felt that the Malagasy wanted us functioning with them from a grassroots level expressed need, not a top-down dictated from USA.
It did just really point out there was great benefit in having a grassroots organization that was formed out of the motivation of people who knew it and felt it, rather than necessarily a large bureaucracy. It needed something where there was that passion, that firsthand experience, where they weren't countries, they were people.
When I got to Golden Valley Lutheran College and I found an office with no equipment, no supplies, I thought, boy, this is beginning from scratch. We opened the office in February, and when I met with the executive committee in October, I had to report that we had not received a single gift during the previous month, not a single gift of money, not a dollar that had come in. I said, is this going to work? And we talked about it. And one of the directors said, well, you know, we gave it a good try. We did our best. And if we have to close, we can at least say we tried and we did what we could.
And so there was a lot of prayer over it. And there were times when we did wonder if it really was something that was meant to be, or if it was just a good idea.
And then I think God moved Dr. Leonard Ackland to say, look, Thanksgiving is next month, and Christmas is the following month. That's when people really begin to think of giving and to sharing and to giving to the church and charities. Let's continue, at least to go through November and December. And so we got to work, and we used those two festivals as touchstones to see if we couldn't increase our income. And there was never any turning back after that. And I almost get cold chills when I think of that now, that we actually talked about not going further and disbanding, and look what's happened.
The mini garages, it was the start. There were very few of us. It was really a lot of fun in a way, and it was an adventure.
I remember the first time I went out to the storage units, and there was a storage unit that had been accumulating boxes and boxes and boxes and boxes and boxes. It was like a flood started. The equipment and supplies just came pouring out of all directions.
We did everything in those days. We loaded, we did everything. So we had to do it, and it was in December, and it was snowing. We had big boots and coats on, and everybody was dragging boxes down, and I was using a forklift, and we loaded the container, and it was cold.
Oh, we were sorting instruments, scissors and tweezers and all that, with our gloves and mittens.
We did a lot of the work outside. In the summertime, it was hot.
It was a sense of accomplishment, and I remember that we prayed each time we closed a container. What a privilege it was to be part of that ministry.
First, we started out with only a closet for supplies, and then we had storage units for supplies. Then in 1995, we got our warehouse, and we thought we're set for life. And then a few years later, we saw that wasn't large enough, and we had to go again. Themes developed. One, helping the hands that heal, and continuing the work of Jesus, continuing Jesus' ministry, because we saw Jesus equip and train and authorize the disciples to continue with medical work, and that continued through the history of mission.
Part of the reason Global Health Ministries could be established and grow is that everyone in the church knows that Christ's ministry was teaching, preaching, and healing.
The thing that I'm struck with, and I've never forgotten, is that what did Jesus do when he was here? I think I get the impression that about his greatest ministry was healing the people. And therefore, I don't think we can abandon that. That's what we're trying to do.
We really wanted to do that, continue the healing ministry of Jesus. People rallied to that. They wanted to be a part of that. And they wanted to have an opportunity to get their hands on mission work. You know, you can give a check and that's it. But if you become involved in funding a particular thing, or if you get involved in bringing together medical equipment supplies, you can say that this gives you a hands-on, direct involvement in the mission of Jesus in the world today.
there was this agreement that a new building was needed, and I went out with the realtor a number of times, didn't find anything at all suitable, and one of our volunteers found a space and said, go look at this space because that's going to work. And we went out and looked at it, and sure enough, it was perfect, and the price was right, and I came up with all these ideas about how we could have this 2-story building with 6-foot ceilings or some such crazy thing as that. And an architect friend said, no, you don't want to do that. So he volunteered to give us a plan, and the plan is what you see at Global Health Ministries now, Building 1. So it was all part of letting people be energized to do what they knew how to do, and it all worked out perfectly.
And I was invited to a fundraising dinner one night by a couple who have never had anything to do with Global Health Ministries before or since. And they were just buying the one building, the first building, had just purchased it. And they had a request for people to help paint and stuff. Well, I called over there, and of course I got a hold of Ken Grosh, who immediately started conning me. And he said, yeah, we need some help painting. He says, you ever done any wiring? And I said, yeah. How about plumbing? And I said, yeah, a little bit.
A number of times we have needed something for a place. They have been giving us requests. For instance, there was a request from Liberia for over 30 file cabinets. We did not have 30 file cabinets, and we could not go and buy them because they were expensive. We prayed about it. 2 days later, we got a call from Hennepin County. Can you use 30 file cabinets? And that, whenever I tell that story, I just get goosebumps because it is so unbelievably real that God is there working with us. And not only that instance, but many other times that has happened. Prayer is very powerful and very important in our ministry.
Well, if I can speak so frankly, I'll say this. Healthcare professionals are a unique breed. You know, we are unique in the way we look at the world. We are unique in how we function. And we have some quirks about us that I think society doesn't always understand. And because of that, if we can have like healthcare professionals helping other healthcare professionals get to their objective, we don't want to always take the traditional path that a business or a commercial entity or other organization would take. We see the world from a very different perspective. And that's what I really saw as Global Health Ministries growing out of that need, not because of so much a failure of someone not doing it for us, but the understanding was not there. And I think when you have people in one location, our partners or the missionary or whoever is in that location, and another group who really understands the dynamics of healthcare, we're unique. And I'm glad we are that way, but it takes some special understanding to make things work and make them sustainable. And that's what Global Health really was born to do.
From a microscopic scale, you see God working in your own life in a lot of little ways. And you realize how He's putting the pieces together. He's placing the call and fueling your ability to answer. And yet He's doing that all over. And our ability to help that through healthcare and deliver the message of Christ through healthcare all over is just profound.
And I thought, in one way, God has prepared me for this. So I felt that, well, I've had administrative ability, I've known the church, I've been out speaking, I've a known quantity. Why not look at all this stuff as something the church has invested in me, and I can do this.
That we could make a difference to them. That's what really helped me. It made it clear to me that I could make a difference. I could go out there and help them.
It's interesting how God works His calling. I look back, my first job after college was working as an orderly in a hospital, and part of that was to work in the supply room and to find out what all those things were. Being a farm boy from southern Minnesota, I didn't know what these different hospital items were, but through that learned the supplies and then just the whole hospital system and how God was forming that. And then through education, picked a major of medical technology or lab medicine, and how that would be used to go over there and just putting it all together. And it all worked out over a long time, but it turned out that all those different things were just the pieces that were needed, and it turned into a lifetime.
Actually, I felt the call to be working among the poor, but it was in the Appalachian Mountains. And I had this call ever since age 12, and it never left me. But then he came along, and somehow the Appalachians changed to Madagascar. But the call of the poor, encouraging the oppressed, is what my life was. So that's the work of the Spirit, in my opinion.
We had definitely international biases or feelings, and then I think that with a medical background, it is kind of an easy opening to get in. There are lots of opportunities to do it that way. So I think I followed my natural inclinations.
We were able to find a wonderful little hospital in Assam, India, that really spoke to us.
It was so much fun to see, because having seen those two empty buildings out in the middle of nowhere in '06, and then seeing a living hospital now that's been working for a year, it was like you read storybooks when you're little about a storybook hospital in Africa, and this was a little storybook hospital in Africa. I mean, people come there, they meet there, they see each other there, they get what they need there. You know, and I said, every place in the U.S., we use the word health center and this center and that center, and we use the word center just because we need a noun. But there, center it's more than a noun. It's actually a center where people come to gather, and it was really, really fun to see a working hospital that we had something to do with building.
And at that time, the church said, "We want you to do this particular job." I said, "I don't think that's the job for me, but if you think it's a job for me, I'm willing to do it." And then the night before our final interview, I got called into the office here in Minneapolis, and they said, "We're changing the job description. This is what we want you to do instead." And I said, "Oh, that's me. That is exactly right." So the day before we were to say yes or no as to whether we would accept this call, the job description changed, and it was a perfect match to my background and my interests and my skills and whatnot.
I was called to this ministry of global health by Ken Grosh. And the reason why he called me was because a pair of friends of mine in a congregation that I served in Omaha, Nebraska, who I never knew were involved in Global Health Ministries to this day, put my name in the hat of the committee that was searching for a new executive director. The matching of everything that I have had grown up to be, was trained to be, loved, international cross-cultural experiences, work in development and planning of social initiatives, and witnessing in practical, concrete ways to the love of God in Christ, all together in one package. And when I put that all together, I was nailed, or if you will, I was called.
We had a calling to Madagascar, and I can't say that a call could not be more direct. I was coming back. I was a deacon at our church in Long Prairie, Minnesota. We were having a difficult time with building onto the church, and you can imagine the frustrations, and things were not going well. Things were not going well at my practice, and I was driving home to our little house 5 miles back in the woods, and I said, "Lord, I don't care what you do with me, but you have to give me peace. Let me know what you want to do." And I no more got into the house, hung up my coat. Joanne was watching Walter Cronkite on the news at 10 o'clock, and the phone rang, and Dr. Tim Reitz called and said, "John, we're going to be working together in Madagascar." And I stopped, and he said, "John, are you there?"
As a 5-year-old, I went around our neighborhood saying that I wanted to be a missionary, like my parents in Madagascar. And I didn't realize that I said that as a little child. And so it was interesting that even at that early age, God had put it on my heart that this was to be my call to follow my parents' footsteps in Madagascar. So it was fun to see how God worked from those early days to prepare me for when the door would open to say yes to the need that I became aware of when I was in nursing school.
As we look at the call, let's not put God in a box and feel that the call is just this defined. A lot of us like to have down on black and white, okay, what is the job description? Tell me exactly how this is going to be, and from sunup until sundown, but something exciting when you're in the Lord's ministry and the Lord's work. Every bend in the road, there's something new to see. There's something new that you will be confronted with, new challenges, but knowing that in answering the call and sensing the direction that God is calling and being open, there's just an unlimited number of possibilities the way God can use us.
I'm a worrier. You know, I'm a control freak. I wanted things to happen in certain sequences and timing, and I want to know what's going on. I don't worry about that anymore because this is not my work. This is God's work. I'm along for the ride. It's very freeing.
I felt, especially one evening, I felt the call very clearly while I was there. I had already been sick for a couple of times, and illness was everywhere, and I was not immune, so I was sick, and I was sitting outside my house and looking across the Benue River. The sun was setting, and I remember saying to God, why am I here? What's the purpose? And just at that moment, I saw a boat that had a mast shaped like a cross, and with the sunset in the background, and that just nailed it for me. I never asked that question again.
I was once in Mother Teresa's mission in Calcutta, and there was a quote on the wall that said, you can do far greater things if you lean not on your own strength, but on Christ. And it was a hard place to serve. But it was phenomenal how much at the end of the day, you went home invigorated, you went home empowered, you went home fulfilled in a way that was phenomenal. You woke up each day not knowing whether you had the strength to do it again, but you went home every day saying, I gotta get back.
Some Tanzanian doctors approached us and asked us if we could find some resources for them in their small medical clinics. And they were struggling, they were demoralized, the work had been neglected. And we heard that Global Health Ministries was available and was willing to look for ways to encourage local people in their settings to make their work a little bit easier, whether that was using equipment, whether that was education, whether that was better water supplies, whether it was more training. So early on, when we approached Global Health Ministry, we were really thankful that they were willing to listen to the problems that were on the ground and were willing to be flexible and work with us in addressing some of those issues. Many of my Tanzanian doctors told me that if Global Health had not stepped into the picture at that time, they would have given up and left their posts out in those isolated areas.
I remember, as I'm often called to do, to tell the story of Global Health Ministries in churches, and someone came up to me afterwards and said, yeah, you are so excited about Global Health Ministries. There must be something really wonderful happening there. And I said, yes, it really is. And I said, you know, after 15 years of parish ministry, I wish that Global Health Ministries, I wish that more churches were like Global Health Ministries, you know, with that same kind of mission enthusiasm and involvement of the people and sacrifice and witness and so on that was going on amongst our ranks. And the man looked at me in a moment and he says, You don't have to wish that churches could be like Global Health Ministries. Global Health Ministries is the church. And when I think about Global Health Ministries, that's what I think about, is God creating the best of what the church is about. Sharing the love, sharing the spirit, sharing the challenge of our mission, and engaging people's best to achieve what God has called us to be about. That's the church in action. That's the church alive.
And that means making larger commitments. It's not just, the first focus was on more short-term projects. That has evolved into long-term commitments of many years, saying we are going to accompany you and help to raise support for the things that you've asked for, but also addressing healthcare administration issues or management of facilities or other more integrated approaches to healthcare, addressing not just direct services in a hospital or clinic setting, but how to support primary healthcare at the village level and helping to really invest in prevention of health issues and working with agriculture and education programs and a broader array of social conditions that can impact health status.
In fact, those farmers really are not waiting for a miracle, but they're really willing to participate in whatever help we can give. And I was so elated when I saw Avia start with the well project first, because their first word when got in the villages in 2008 was, help us with the water. And we looked at the water that was bad. They're just drinking mud water practically. At one village, the people told our staff on the ground, since we've come to our village, and until you took care of the water problem, we never listened to you. Because so many experts have come to our villages and they went back to replace and never came back. They promised the same things, never followed up on what they said. But Avia took care of our water and the door is now open. But before you took care of the water, we didn't care much about your talk. It was too cheap.
At Lutheran Church of the Good Shepherd, we started out supporting 3 ministries, 3 projects in Ethiopia. It was a part of a major mission initiative that started in 2005. And so what we really wanted to do was help them. And then we went there and we met the people of God at Mekane Jesus, and we discovered there was no them. There was only us, God's people. Different faces, different places, different life experiences, but the same Lord who redeems us, the same faith that gives our lives meaning and purpose, the same baptism that draws us together as family. And we are family with the people of God in Ethiopia. They are brothers and sisters, and working with Global Health Ministries has enabled us to be in ministry together, to help them be the hands of Christ in Western Ethiopia.
The thing that rewards me is being able to actually see the work that's been done. We went there, we saw that they had need, we came back, we worked with Global Health Ministries, we sent a shipment, and then we were able to go back and see the joy on their faces with the equipment that we had sent. The operating room that now had a beautiful operating room table and lights and all the things that they really literally had been taping together and barely keeping operational. To me, that was so rewarding to see, okay, here's something that we had no idea we could accomplish, and with the help of Global Health Ministries, we were able to accomplish it.
So we've developed a program through the University of Minnesota's medical school to bring medical students for a 4 to 6 week rotation at Alula. We try to make that multidisciplinary, so we try to bring nursing students with us, as well as University of Minnesota College of Pharmacy students with us as well. So it's actually kind of a multidisciplinary immersion experience for a couple of reasons. One is that the practice of healthcare here in the United States is more and more multidisciplinary. So allowing students to work with each other and understand the benefits that pharmacists and nursing students and medical students all bring to the healthcare picture, it's just a great way to do that. Medical students, it's important for medical students, it's important for all of us to get outside of the United States and understand what the larger world is like, and what the needs of the world are.
Yes, I would say that the experience in Madagascar made me a better doctor. Expanded my clinical skills, expanded my appreciation for world medicine, for the people who practice in those kind of situations, circumstances, and also appreciative of how the Lord guides us in and through all these situations.
This young man who has epilepsy, so he keeps falling in the fire. And for 4 months they had been dressing this wound on his forearm. Half of his forearm had no skin, and they just kept on doing dressings, hoping that something would happen. And I said, why haven't you grafted this wound yet? And both Krista and Marcelin said, well, we don't know how to do it. We don't have a dermatome to cut the grafts, and we've never cut grafts with a razor blade. So I said, okay, before I leave, I'm going to show you how to cut grafts with a razor blade. So we did that, and we numbed the little kid up, and we cut the grafts. And then just a week and a half ago, on a week ago Sunday, I got an email from Krista. She said, that graft you did, it took perfectly. And the more exchanging we do actually with scrubs on and in the exam room and actually dealing with patients, the more we learn about how to help them.
The fun part of it is here I'm a pulmonary specialist, so I've had lots of experiences with tuberculosis. At Parkajuli, I saw more tuberculosis and in different forms than I had ever seen here in my 40 years of practice. So we're never done. So you go and you just have a wonderful continuing experience of learning.
I am so inspired by how Global Health Ministries attracts such an array of volunteers. People who may not have any healthcare background are drawn to GHM because they're finding that they have something that they can contribute, whether it's stuffing the newsletters from time to time or sorting things in the warehouse with some simple instructions. They're able to do a key task of sorting through all of these donated goods that we get, or helping to pack the ship containers. So from that level of someone who's not from a healthcare background all the way to, I'm really inspired by the number of people who are saying yes to serving on the board of directors of Global Health, where we are able to, in fact, have some chief executive officers, CEOs of some very big health systems in the U.S. who are saying yes to serve on the board and are helping us to really enhance the capacity of our ability to support the healthcare administration and management support of our partners overseas.
No matter what part of global health you are, you're helping the hands that heal. And that to me is the reason why we're so strong, I think. I think that's the reason why we've sustained such a large group of volunteers for so many years, is because they see the end product whether they've been there or not.
At times we've had just groups come and just watch, and they say, we just can't imagine, how do you ever put anything like this together? And when there's so few people who are really officially employed, and realizing how much volunteer work is being done, it's a huge, huge example of Christ's love and sharing that love.
Among the volunteers, I have often heard the comment, I wanted to be a missionary, but I couldn't. Now I am a missionary.
I think it gives a lot of people a reason for living. We have a lot of people nowadays that just don't have really deep commitment to anything. And if we can reach them, and realize this is something that's going to be really worthwhile and into eternity, why, I think if they can get caught into it, they will be truly blessed and will be a blessing.
They say now that the typical American retiree has almost a third of their potential life in retirement. And we sadly see some of our friends who are just kind of letting those years pass by, where we say, wait to die. And we're not there. And it's just much more fun to kind of kick yourself in the you-know-where and say, let's gear up for one more challenge. And this has been the way that we have found it. And it's been absolutely invigorating. And the other word I use is liberating.
And I use the word wonderment. To go somewhere and just wonderment.
What I would probably more appeal to is to the younger generation, to come and see. And not many of them will maybe feel called to do this, but what is needed tremendously is to people like this to go to Africa to see what's possible. We are developing a new paradigm and a new way of providing medical care.
So the reason you want to get back on the mission field is you've tasted it. You've been part of it. He's used you in a way that's been impactful for his glory. And so you want to keep coming back to that well. And Global Health Ministries is one of those wells right here.
Well, I would say to anyone who's sensing, even in the smallest way, the calling to help with something like this, that there's absolutely a place for anyone, whether it be the 1 hour a month to help in gathering supplies, whether it be the $10 or more donation, or to be a lifetime of service overseas. There's definitely a place, and it's definitely a calling. And for each person that does that, they truly are part of the mosaic that makes it all work and makes it exciting and makes it fun.
There are a lot of trained African professionals. So I don't think our goal should be to replace them. I think we need to put our best efforts into building them up, to giving them the resources that they need, to develop systems where African Christian professionals can devote their lives and careers to servanthood.
Some of the projects that we've worked on have had to do with governance issues, helping boards of directors create new bylaws, oftentimes helping them build a board with greater diversity to it. So not only church members are on the board, but also membership from other health roles within the country, whether that be from other health systems in a business kind of capacity or from the governmental health units, business people, community liaison. The hospital is now accountable to a larger set of people and gets a great diversity of points of view about specific topics.
It's one thing to ship a container full of stuff, but then to make sure that it's properly inventoried and properly kept, and that it's used, and that it's not thrown away because it's expired or it's been sitting on the shelves too long. I think this is a huge part of that Global Health needs to be more involved with and in the future, and looking at management.
I think the fact that we are using this freedom to really open up some unexplored areas even, the fact that one of the catechists we've trained was able to build a local farmers association producing vanilla and coffee, that was something really unseen before, because some NGOs are paying millions to hire the extension agent and to build those local communities into farmers association. Here we see a catechist who has the training prior to going to Bible school initiate such association of farmers.
The people who have been a part of the formation of GHM and have carried it along these years are praying people, and I would certainly urge that this kind of person continue praying, continue encouraging people. Just for instance, as you look at Madagascar, it's a country that has just been, it's as if it's in a war zone. It's been battered. We need people who will encourage and pray, show kindness, and give.
I see Global Health Ministries in the future really looking way beyond our capacity now. We've seen a little bit of that by way of for the first time, establishing a Global Health Ministries branch office in Madagascar, where we are building on our on-the-ground capacity to hire people from that country where we're working and to extend our presence to be able to, again, further engage colleagues in the countries where we work to make sure that Global Health is investing in programs that are going to be supported by the infrastructure of that country, and we can help enhance and strengthen the infrastructure, whether it's of the church or other health programs in that country, so that we will be able to expand our ability to support additional programs in places where we've not been. So I envision GHM being involved in many more countries, and we're going to, I think, be more successful in working alongside other partners in healthcare.
I think Global Health Ministries will serve a larger role in coordinating and facilitating partnerships. We can't do everything, and it's clear that as we embark on doing more community-based primary health care and things that are working more directly with a village and with public health rather than within a hospital system, you need to have clean water, you need to have sanitation, and so it's going to be critical to our success to be able to partner with organizations that can partner with us and work with us to be able to develop everything that the community needs to be successful.
I believe that in order to do that, we will need to continually draw upon, recruit, involve people with a heart for this mission, but also with different competencies. We're drawing upon hospital administrators now. We're drawing upon computer technicians. We're drawing upon people who are inventory managers in hospitals. We're beginning to spread out in our involvement of people because we have discovered that all of those skill sets are required for the success of our ventures overseas.
Things are getting tougher given the situation around the world, but I think GHM is such a position to turn around some lives and real lives. So I've seen it at work. I truly believe that we can go deeper in our mission and lift many, many people.
After 25 years of the efforts of Global Health and the volunteers and the people that made it all happen, what I'd like to express to them is that if you go out into northern Tanzania, there's some small medical clinics out there with a staff of 4 people who are the only medical care in a vast area, maybe 100 miles by 50 miles, where people can come and they can receive treatment for infectious diseases like tuberculosis and malaria, where there's a doctor who will recognize anemia and malnutrition and can take steps to address it. There's a place where pregnant women can come and get prenatal care. Infants and children can get their immunizations. And as the world population continues to grow, birth control is being provided in different forms and in effective ways. So I'd like the people at Global Health to know that because of them, there's 10 clinics out there that wouldn't be standing, that wouldn't be functioning if they hadn't provided some very basic resources and encouragement and education. And so that's what's exciting for me in our medical work and what Global Health has been able to do for us. And now we've been together 15 years, and the majority of us are intending to put another 10 years in there. So I think Global Health made a really good investment in us, and I believe their investment's going to continue for another couple decades.
Well, I just give my heartfelt congratulations to Global Health for 25 years of helping the hands that heal. I can just extend Psalm 67. God be gracious to us and bless us and cause his face to shine upon us, that thy way may be known on the earth, thy salvation among all nations.
And I just want to say thank you to everybody who's been involved during these 25 years. And if some of you get as old as me and need to be replaced, get your replacement and get them as enthused as you are.
This journey with Global Health Ministries for me has been a journey of joy and appreciation. And those folks who are gathered here at this event are all part of that support system that has given me the joy and the satisfaction of a job well done. Not a job from me, but a job of Global Health Ministries well done. I had commented earlier that the secret for success and my success was to be incompetent so that all the volunteers would have to step forward and grab the rope and pull on the rope. And so they have done, so that the support system has been terrific, both financially and volunteers and those healthcare workers overseas. It's been a terrific team effort, and I was privileged to be hanging out with this group of people for 12 and a half years.
I cannot believe it's 25 years. I'm still remembering in the driveway of the storage areas where we were putting boxes together, and we actually were going to fill an entire 20-foot container one time, and we celebrated that. And now I look at the volumes of 40-foot containers that we send out to different countries every year. I never ever had a vision that it would be that big to that point, and I think it's come from every single person who's entered this organization, whether it be physically into the building or virtually into our network. Every single person who's come forward has added something to who we are, and I am so grateful to God for every single one of them.
For everybody that has supported Global Health Ministries and continues to support us into the future by volunteering, by financial support, the impact that you have made on the world is significant, and the impact that you have made on individuals is significant. And it's important for us to be able to continue to fulfill our mission of impacting the health of people abroad, but also impacting us here in how we bring health and mission and gospel to the people that we're working with. And it's critical to our future to continue to have your support.
I would like to congratulate GHM for the 25 years of existence up till now. And I would encourage GHM to move forward, but remembering all the time that the gospel of Jesus Christ is the center of all that we are doing. That there is no other name under heaven by which we can be saved, and that is the name of Jesus Christ. That has to be maintained.
So I think there'll be changes. I think we'll have to be flexible, but I think the needs will be there. I think the people will be there to respond to the needs, and we just have to continue to follow God's lead and how to react to changing situations and changing needs. So I'm no prophet. I can't predict what's going to happen, but I think the next 25 years are going to be exciting.
Oh, well, it's been such a privilege to work and do what we have done, and now that we can't do much anymore, why, it's our prayer that people don't get weary of doing this and continue to keep this ministry going as long as there's a need for it.
Give me another amen.
Amen. Amen.
Amen.
Amen.